I'm really excited. Our first session today is about behavioral health careers. And we have Dr. Kei Nakazawa, who is a psychiatrist with the Department of Psychiatry and Behavioral Health Sciences at UC Davis Health. We have Dr. Amy Offeld, who is a licensed clinical and consulting psychologist. And finally, we have Angela Trapp, and she is a life coach and founder of 3C Coaching, Consulting, and Connecting. Remember to type your questions into the chat throughout so you don't forget them when you have them. And we will take a few minutes for Q&A at the end of this session. Also, we're going to have an activity, so please make sure you have your pen and paper ready so you can participate in that. Or of course, you can type it out too. So I believe we're starting with Dr. Nakazawa. You are up first. Please take it away.
Great. Hi, everybody. It's so nice to meet you all. And, feel free to call me Kay. So I am a physician at UC Davis Health in Sacramento, but I am a bit of an oddball. I didn't quite take the normal kind of path to being a doctor. But that's kind of where I wanted, one of my kind of messages that I think I want to share with you is really just how important it is to follow your heart and, not being afraid to carve your own path in your career. Because, I actually didn't really think about being a doctor when I was, young. Like I actually really loved architecture and like art. So that's kind of what I was more obsessed about. So when I went to college, I was kind of balancing, do I want to do more kind of architecture kind of things or more technology related work. And I ultimately did a lot of biotech research in college and ultimately realized that that's not even something that was really fun, but I was trying to grow like kind of organs in the lab with the cells. And it was super cool. But in that process, I realized, God, this could literally take 50 to 60 years before any of this helps a patient, because that's just generally how long like technologies take. And for me, I tend to be a little bit on the impatient side. And so I was like, well, I feel like there's some problems that need to be addressed like right now, I wanted to I was kind of eager to do something, have an impact now. Not that, with biotech researchers, they have tremendous amount of impact in their careers. But for me, I guess, again, I was a little bit more on the impatient side. So I went to Bangladesh for a year after I graduated and really saw how much most of the world has literally, a fifth or a tenth of the kind of technology and medical care that we have here in the United States. And, that was really mind-opening for me to just kind of realize how much the world needs really basic healthcare. And one cool thing, though, that I noticed was like at the same time, everybody was like using a cell phone to like text each other. And this was like 15 years ago. So, it really, even like in the States, like my parents didn't know about texting. It's like, so I was like, wow, like people in Bangladesh are like really advanced, like they're using like really, technologies in a way that I wasn't used to kind of using technology. So that was really mind opening to kind of say, wow, there's so much you can learn, from just like different people in different countries. It's just like, just keeping that open mind. And for me, I realized I really wanted to come back to the United States and work on healthcare in a more entrepreneurship kind of way. So I came back, I needed a job. So I worked at a winery in Napa for about 6 months. And then I found my kind of actual job that I would take full time, which was in Washington, D.C. And ultimately I worked, in Congress to work on the Affordable Care Act, which some people might know as Obamacare. So this was about 10 years ago. And again, that until then, I had not even thought about being a doctor, but really working on in Congress on healthcare really made me realize how little I knew about how medicine is actually practiced on, on the day-to-day level. So we were working on a very kind of 30,000 foot view of healthcare, but I just felt like there was such a big void in my knowledge. And that's when I actually really start to realize, I actually do want to be a practicing doctor and really have that type of knowledge. So then I applied to medical school while I was working there, and I got in. I'm a Californian. I'm from LA, so I always want to come back to California. So I was really, really excited when UC Davis accepted me into their medical school, because they're also really advanced in technology. They do a lot of really good work in telemedicine. So long story short, going through medical school, I kept kind of doing the entrepreneurial thing. So I started a small kind of medical education technology company while I was in medical school. But I had, my mother actually got cancer during medical school, and she passed away actually during medical school. So for me, I really hit my max actually in terms of like just bandwidth, like, just juggling medical school itself, having a company to run, and then having family issues on top of that. One lesson I learned from there was just that you always need to kind of have a little bit of buffer left in you just in case, because life isn't always perfect, and I never had to deal with such a big kind of family issue until then. So for me, it was really hard to, like all of a sudden I was cornered because I had no time to really dedicate to any of those things. And ultimately I survived medical school, but again, I had to kind of recarve my own path from there, because my medical school experience wasn't didn't go as expected. I was still running a company, and ultimately I just kept kind of following my dream of like being able to be innovative in healthcare. And ultimately what that led to was an opportunity that literally came around about 4 or 5 months ago, to help launch a digital health innovation hub at UC Davis Health. So again, I'm actually not a practicing doctor. I didn't go through residency, which is the training part of your medical, kind of your medical career. So I have an MD, but for me, my heart has always wanted to be at the intersection of doing cool things while really connecting those cool things with everyday medicine, so that patients, get the best healthcare that they possibly can. And with this innovation hub, which is called Davis CoLab, actually one of the mission actually is that we really want to build technologies that are really inclusive. So what we noticed during COVID was that everybody started to realize telemedicine is something that's like something that it can be really good at delivering care, accessing care. And so the promise of telemedicine, digital health, is that like anybody can get healthcare through digital health. But during COVID, we also realized that that doesn't just like naturally happen. There's so many communities around Sacramento region and all throughout California where they didn't have reliable internet access, they didn't have a smartphone, they didn't have the things that you actually really need to get telemed, to really receive the care that was available. And all on top of that, it was like dangerous now with COVID. It was dangerous to go to the clinic. It was dangerous to go to the hospital. So some communities actually, got arguably worse in terms of health disparities, right? And that's also one of my kind of messages is technology isn't the solution always, right? Technology is just a means to end, but you really need to think about it people first, problem first. And one of the goals that I'm going to have with this Davis CoLab, a digital health innovation hub, is that we really want to come up with solutions that are really inclusive. We want to make sure that we leave nobody behind when there's telemedicine and digital health and all these like really new opportunities that are emerging in ways that we can connect with patients that don't require them to come to the hospital or the clinic. But my role is working with a really diverse team of doctors, nurses, physician assistants, engineers, business strategy people, marketing people, patients across many different communities to really start to rethink how healthcare should be delivered and how healthcare can be delivered if we use technology and people in the right way, in the right combination. So again, I always, kind of, for me, it's been a really wild ride. And where I'm at, I never could have kind of predicted that I would kind of be in this type of role. But one thing that's really been my compass is like, I always wanted to make a difference with what I do. And I've just really tried to do a good job at whatever, project or job that I had every step of the way, and just kind of trust the universe that, the right opportunities will come around if you keep, really focusing on doing a good job in the every moment. So, I have no idea how this new role is going to be because it's a pretty tough challenge. But again, I just really encourage all of you to follow your heart and really do what you love and do it really, really well. Work really hard. Don't be afraid to make mistakes. One for me, that one mistake, one of the many mistakes, but one big mistake was really also being a little bit too idealistic with everything I can handle. So sometimes it's always also really important to just have a little bit of buffer just in case to make sure that you have that extra juice in the tank when you need it. But otherwise, it's such an exciting time to be in this world, in healthcare. And I'm totally open to any questions or people who might have interest in pursuing a career in medicine, whether it's a doctor, physician, nurse, or physician assistant, or you're super into tech and want to do, kind of be an engineer. I just want to open it up to, any questions or follow up even after this session, because I think, your generation is really going to make the real change in our healthcare system. So I'm just looking forward to seeing all the amazing things that this group and your entire generation will do for us.
Thank you, Kay. That was awesome. So guys, if you have any questions, just type them into the chat and we'll ask them at the end of the session, or you can raise your hand later on. So next, we'll hear from Dr. Alfeld. And Amy has been a partner of the Medical Society for a long time, so we're really excited to have her here today. So Amy, take it away.
Thank you. Thank you so much. So great to hear Dr. Nakagawa. It's so interesting how we end up in the careers that we end up, and I think to just tell all the students out there, it's not always linear. You might think you know what you're going to do, but then you know what? Things change and you have different life experience, and it leads you a different direction. And my story is kind of similar. What I thought I would do, I have a presentation, so I thought I would just have some slides. So I don't know. I'd love it if you guys who are not showing your faces, it'd be great if I saw that rather than your names, but it's okay if you are not in a place that you can, show your face, it's fine. I'm going to share my slides if that's okay. That'll work, Lindsay, I think. And then and it's kind of fun to talk to you all because I have a couple teenagers myself, one who just graduated and we just had a graduation party. And so there were tons of teenage kids at my house all talking about the different careers that they want. So, and some of them interested in psychology and medicine, and healthcare. So very fun to talk to you. I've had the opportunity to talk to other classrooms, psychology, high school classrooms. So I'm going to give you an annotated presentation here, and I'm going to share my screen. Okay, let me go to my files. Sorry, just a second. Okay, so yikes, let's see. I want to make sure that this is, because when I'm going, and this is partly why we do this ahead of time, but hold on, it's going to be here. Okay, let me just sorry. My screen is up. And Appreciate your patience. This is probably why I should have come on earlier to make sure that it was working. Just have to make sure it's saved. I don't know why it's not coming up. Okay, here it is. Nope. Sorry, guys. Okay, here it is. Save. As. Says it's saved to the desktop, so I'm going to just make sure. Okay. Okay. All right, when I select it, I wonder why it's not, oh, here it is. Okay, perfect. Okay, and I'm going to share, I'm going to go to the beginning of it. Are you seeing this right now? Okay, so I'm going to go, sorry, I'm going to just go back to the very first, and I'm not going to show you all of these, but welcome. Okay, so let me just start again. Sorry about the delay. I'm a clinical psychologist. My name is Dr. Amy Offeld, and I have a private practice in Midtown Sacramento. And I thought it might be fun to give you a few just quick kind of facts and overview of psychology and being a psychologist, and then give you some, I have pictures of my office in here and things like that that you might be interested in. So first of all, just in terms of what psychology is, right? It's the study of behavior and mental processes. Behavior, as you can imagine, right? There are good and, positive and negative behaviors, but it can include anything that can be measured, right? Like walking, talking, eating, your blood pressure, exercising, alcohol or drug use. Behaviors can be either healthy or not healthy. And then the other mental processes is really how you think, right? Your cognitive activities like, your IQ or, your learning abilities or dreams, perceptions, thoughts, memories, those kind of things. So psychologists are experts in studying both behavior and mental processes. There are about 16% of people, this is a statistic several years ago, identified themselves as psychologists. There's a lot of behavioral health and social scientists, and 16% of those folks are psychologists, and that I believe is worldwide. What do we do? What does a psychologist do? We do a whole host of things. And that's why I think I have really gravitated, that's part of why I've gravitated to be a psychologist, because I feel like you can do anything. If you want to teach, you can teach in a college, or you could, if you want to consult, meaning consult with other health and behavioral health professionals or physicians or organizations even. You can go into businesses. Google has psychologists that are psychologists there, helping them be more efficient in the way that they work, and also help them lead the way about what human beings, what our patterns of use are with the internet. And psychologists have a big part of that. Well, you can do research. If you like doing research or you like being in a lab, you can do that as a psychologist. If you like to assess, if any of you have ever had, an IQ test, or you've ever had, been evaluated for anything for learning abilities. Some people have had dyslexia or have a learning challenge. You usually go to a psychologist who then can kind of do an assessment where you take all these tests, and then they give you kind of some data from that. And then they also make some recommendations. So there's lots of different, and then people come to therapy, right? And primarily what I do is I'm a clinical psychologist that sees patients for therapy. I see individuals, I see families, I see couples. And I also do some testing for people who have been hurt on the job, or who have emotionally been hurt on the job, who have a workers' compensation claim for a mental or emotional reason. And I do those assessments as well. So I love it because for me, I like doing lots of different things, and it helps me kind of have some variety in what I do. And most of all, I like that in all of those ways, you're helping people, organizations, individuals, groups, in whatever way. So I really enjoy that. Where do psychologists live and practice in the US? You can see we have a lot of psychologists in California, but you can see the different shades of blue on the screen. And I can give you these slides after for those of you that maybe can't see it, but I just thought that might be of interest to you guys. And, you know, we have a big state, we have a big population, and we're in need of more and more psychologists. Being a woman myself, I'm always interested in how many women have been in the profession. You know, many years ago, this only dates back to 2005, but earlier in life, most people who were psychologists were not women. It's become increasingly more of a female dominated profession. Certainly master's level clinicians are definitely, you know, female dominated, but even among doctoral level psychologists, which is what I am, there are more women nowadays coming up through graduate school and becoming psychologists. And then I think it's important, and you know, in terms of race, ethnicity, it's still a predominantly white, you know, profession. We need people of color, we need women and men of color to enter the profession. And so I think it's really, you know, I wanted to make that point too. I think there are a lot of you, maybe you know, individuals of color, and there is room and a desire, especially people who can speak more than one language, who can, you know, and have different cultural understanding and cultural background, because there's been stigma in different cultural groups where some people don't access or don't have access to see a psychologist because of that stigma. So the more people that are in the profession that are representing those cultures and groups and languages, all the better. It makes the profession better all around. So wanted to share that. What are the ages? I mean, it makes sense that a lot of psychologists are at least, you know, 30 and above, because it takes a while to get your doctoral degree. I'm not sure, I'll just share what it took from me in terms of my education, but in general, you have to have a PhD or a PsyD, which are both doctoral degrees, to become a psychologist. So you go to, you graduate from high school, you go to get your bachelor's at a 4-year university. You get your bachelor's, you can get your bachelor's in anything. You can get it in psychology and or any other, you know, degree, but you can apply then to go to graduate school. And that is going to take you anywhere from 4 to 5 to 6 extra years of study. And then during that graduate time, you get to work with different populations in clinics, hospitals, community centers, that you're in training, and you have licensed people who are looking over your work and having consulting with you and making sure that you're doing good work there. And then you're also writing a dissertation, which is kind of like writing a book. Mine was about 225 pages. So it's writing a book, it's proposing a study, doing the preliminary research about whatever your topic is, then conducting the study, and then writing it all up. And all of that takes anywhere from 2 to 3 years during your graduate program. And then you have to defend it. You hear people talk about their dissertation defense, which means that you have faculty at your university that you then are sharing your research, and then they can challenge you or you know, give you different hints of where else to take your research. But that's the process. And then when you have completed all your hours and you've completed your dissertation and published it, then you get to graduate with your doctorate. And then after that, you take a bunch of licensing exams. You take a national exam, and then you take, depending on where you live, each state has their own kind of law and ethics exam. So typically, to become a licensed clinical psychologist after your bachelor's degree, it's about 6 years is what it takes. Some people might do it in 5, but usually it takes about 6 years. For me, I'm kind of atypical because I did not go to, I went to undergrad at the University of Michigan right after high school. That was where I went to school. I did major in psychology and women's studies, but then I had a long time that I worked in a lot of different type of careers and did not go right to grad school. So I didn't start grad school till I was about 35. And about 36. It coincided with the birth of my second child, who I had during my finals of my second year of grad school. But that I did it a little bit differently. I'm so happy I did, though, because I had a lot of life experience in between that I think has made me more solid as a clinician. Where do people work? What sectors do people work in? These are the settings that a psychologist will work in. You know, there's a lot that work in a university setting, whether that's teaching or at universities, they have a counseling office where students can access. I have a friend who's a psychologist at UC Davis Law School. A lot of the graduate programs like law school, veterinary medicine, regular medicine have a psychologist there to serve those students specifically besides the counseling center. So that can be a place you can work. You can work for Kaiser or work for Sutter, or work for another hospital or health service. You can work in the VA, the Veterans Administration, or for the government. You can work in a business, like I was talking about. Google employs, a lot of businesses employ a psychologist or a few psychologists. Other educational institutions, medical schools, and then independent practice, which is what I'm in. So I'm kind of, I have to deal with my boss. My boss is me, which can be difficult sometimes, but that's, and I have my own office here. There's different types of psychology you can study, and thus different types of psychologists as well. You can be a clinical psychologist, is what I am. Counseling psychologists mostly work in university settings. Developmental study children's development, the work of Piaget. They might work in a program that like a preschool program or a specialty, or they might do research around really young children at the different developmental ages. You could be an educational, you can work in an educational setting or for a school. You can be experimental or research. Forensic just means it has to do with law or the courts. So forensic psychologists, and you guys I know watch a lot of these programs probably that show forensic psychology, like CSI and all of those. And so they, it's basically anyone that's doing work that you then report to the court or have to testify. You can be an expert witness and solve those kind of things. Health psychology, industrial organizational would usually work in a office setting. And then neuropsychologist studies primarily the brain and all the workings of the brain. Social psychologist and sports psychologist, which if any athletes out there, you may have even seen a sports psychologist, because it's not just physical ability, it's what's between your ears, right? That also influences that. You guys tell me Lindsay, I can see you when I'm doing this. Will you just give me just say like you have a minute left for are you timing at all? Okay. So you'll give me a minute warning. Okay. And then this is a picture of my office. This is one, in the actual therapy room. I'm sitting right now in my office, but I have a kind of a consulting, conference area, and that this is a different area, but the door that's right behind me leads to this office that you see pictures of, so that you just see what, and the picture down below is my waiting area. So there's 3 rooms to this office. That's where my patients wait. Until, and during COVID, I've been doing this all virtually. I'm going to go back to my office in August, but that's what's also been pretty amazing. We've had to change, like you guys have had to change for your education. We as psychologists have had to change too, and converted everyone to virtual appointments. And, I have a picture of that clock, because clock is important. I'm not always great with time, and I have to be when I'm a psychologist, because otherwise I will, back everyone up. So it's a challenge sometimes. And then there's a psychologist toolbox. One of the things that we use for diagnosing is called the DSM-5. If any of you have taken a psychology class, you probably have gotten introduced to this manual. It's huge, and it has all the different mental health diagnoses, and it's what we use to be able to diagnose patients. And so there's criteria that you have to meet in order to be diagnosed with a different disorder. We could do, if I had you guys for 8 hours and you were interested in this, we could do an entire 8-hour session on diagnoses, but I thought I would just kind of throw that out there, some terminology, and just so you could see that. Prevalence, and this is older. I need to update these statistics, but it's not unusual, right? And you guys have, I'm sure, in the last year have heard about either your friends or yourselves or family members really struggling because of the social isolation. But I guess what I would want to say, and I'm going to stop here, is just that I'd like to normalize the fact that most people need some kind of help at some point in their life. And rather than see it as stigmatized to seek help from a psychologist, my hope is that people would see us just like you would a coach, or just like someone you would want to get specialized training in. You're struggling. Why wouldn't you go? You want to be able to run faster, you go see a running coach. You want to be able to learn the computer better, you hire someone to come tutor you, right? Same thing with mental health issues, because we have some expertise that can be helpful and applied to you guys. So I appreciate being able to share a little bit. And I know I talk fast, but I'm really so pleased to be able to be part of this panel today. So I'll exit this. And if you have questions, you're going to have what happened? Oh, did I go off?
You're good. You're still here.
All right. Did I exit? Okay. I know you're going to have a chance to ask some questions, but we're also going to give our emails. So you guys, please be in touch if you have any questions.
Okay. So we're getting a nice little list of questions here in the chat, so you can start preparing answers if you want. But first, we're going to hear from Angela Trapp. So Angela, please take it away.
Yeah, hello, Lindsay. I sent over my presentation that Sam asked for. Do you guys have it? Welcome, everyone.
Sam?
Yes, I do. Hang on.
Okay. I'm gonna wait till Sam puts the presentation up. But hello, everyone, and thank you so much for spending your lunch time with me. I feel privileged. Oh, there it is. Awesome, awesome, awesome. So I am Angela Trapp, and I am just so excited to share with you what I do. I think it's one of the most dynamic and just enriching and fulfilling professions. I have had many, many jobs. And I say jobs because it's a difference between a job and a career. I have been a teacher. I've been a guidance counselor. Dr. K spoke to being okay with exploring and not necessarily feeling like you have to know exactly what it is you want to do in your life immediately after high school. I think that is so important. For me, this has been a long journey, and I love it. I look at it as an adventure. Every job that I've ever had is contributing to what I'm doing right now. So before I get into exactly what life coaching is, Sam, could you go to the next slide, please? I'm gonna ask you guys to put in the chat box, how many of you are athletes, or how many of you have even a dance coach, a piano teacher? Put in the chat box for me. Now or in the past, how many have had a coach? Awesome. Looks like a lot of people. Yes. Excellent, 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 excellent. Yes, yes, yes. Okay. Now, my next question is, I had a soccer coach. Wonderful. My next question is, what role did that coach play in your life? What did that coach do for you? Mentor, as he says, mentor. That, oh, wow, I love that. Dr. K said talking values, guided us. Yes, yes, a mentor, a teacher, a coach's guide. So I asked that question, and you can keep responding if you feel comfortable. It's okay. Go out of here. I just want to move forward because I know I'm limited on time. But the reason I asked that question is because life coaching is basically founded on coaching. The only difference is that we coach on life events. So instead of coaching you on soccer or football or basketball, what I do is I coach people on every aspect of life. What's important for them, whether it's a relationship, they need coaching around making a decision about their career. I used to specifically coach on health and wellness when I worked for another organization. But the beauty of this is that the person comes to a place in their life where they decide that I want to do more. I'm not comfortable here. I'm not happy here. I know that there's something more that I have to give, but I just can't figure it out. And that's what we call the blind side. And that's where I come in, the coach come in. Next slide, please, Sam. So what do I do? How do I help that person move forward? Partner with them. That's one of the number one things I do. I am a partner. Think of coaching as personal trainer for your mind, because everything that we do, that we undertake, starts here first. It's the thoughts that we think, whether we believe in ourselves or not. It's the self-talk that we're saying to ourselves, whether we're going to be successful in the goals that we set for ourselves. It's the limited beliefs that we might hold that we cannot get past, or we struggle to get past. That's where the coach come in. And how I help and support that person is two ways. I do what we call deep listening, where I'm truly listening to what the person is saying, what they value, what they care about, the goals that they've set for themselves. And I do what we call powerful questioning. I ask them deep, insightful questions that help remove the limits that they placed on themselves. So I'm a partner, I'm a mentor. I support them. I'm a champion for them. And one of the things that a coach does specifically to help the person move forward towards their goal is to help them challenge the inner critic. And I'm gonna talk about the inner critic in a moment, but let's go to the next slide. I'm gonna just share with you some of the qualifications. Nowhere near what Amy has to do to become a psychologist. Oh my God, no. First and foremost, you need to have some life experiences, because it's gonna make you a better coach if you have some personal experiences that you can draw upon. Second is, yes, there is education. You must, if you want to become a certified coach, attend a coaching school. And there's an organization called the Federation of Coaches. They actually certify or give the stamp of seal of approval on what schools that they acknowledge, because there's a lot of coaches out there that don't have a certification. So what they're kind of trying to do now is bring everybody under this one umbrella and ask for very specific qualifications and setting standards so we can all be on the same page with coaching. I have attended 2 coaching programs. One was a health coaching program, and the other one is actually a life coaching program. So I have 2 different certifications. And if you ask me, it takes like a year where you're You actually have a supervisor that is training you and also observing you coach other people, and then you have to sit for a test. Now, in saying that, my personal opinion is the greatest thing that you need if you're interested in becoming a life coach is having an insatiable passion to help people live their full potential, to really love to see people grow and live their dreams. That to me is the number one qualification. Sam, next slide, please. So I'm coming back, I'm circling back to the inner critic. The inner critic is something that we all have. Whether you are 10, 20, or 80, you have that voice of self-doubt. I want you to think of a time that you wanted to go out for a sport maybe, or ask a girl out, or ask a guy out. And that voice in the back of your head is talking to you, but it's not saying kind words. It's all the self-doubt and the fear. The voice may be saying you're not worthy. Are you crazy? She's never gonna go out with you. Oh my gosh, you cannot, there's just no way you're gonna make the team. Don't even go out. So that critic oftentimes stops us from moving forward, kind of like wants to hold you back, keep you safe. That's what it's thinking. I'm keeping her safe. I'm keeping him safe by telling him these things. We all have this inner critic. So as a coach, I come across this a lot in my training. And so one of the ways, I wanted to give you guys an example of what I do specifically in coaching. So for example, I'm working with a person now who is trying to make a really, really tough decision, whether or not she's going to leave her job and go and start her own business. That's scary. So the critic is active. The critic is telling her, you can't do this, stay on your job, even though she's extremely unhappy. The critic is saying, be safe, stay there. It's not that bad, but she's really unhappy. So all these fears are coming up, and the critic thinks it's protecting her, so it's placing a lot of doubt. One of the exercises that I do with her, or I just recently did with her, is I'm going to share with you today. So you have that pencil and paper. Yes, I'm gonna give you time. Pull it out. Yes, okay, awesome. Now, I'm gonna time you. And what this exercise is going to reveal is just how powerful our self-talk can be. So for 20 seconds, and I'm putting my timer on now, for 20 seconds, I would like for you, let me get my seconds ready. I would like for you to say the most negative things that someone has ever said to you. I want you to write it down. And also the most negative things you've said to yourself. I'm gonna start now. Here we go. 20 seconds. I'm gonna do the same thing. Okay, that's the 20 seconds. In the chat box, tell me, what did that feel like? Did you sense a shift in your energy? What was that like to write down? Felt dark, yes. Yeah. You could feel that. You feel the shift. I felt it. Yeah, unsettling. This is the power of our words. And I forget exactly how many negative thoughts we have a day. I can't remember, but I think it was over 1,000 a day. These are the things that we're saying to ourselves. So the self-talk, the inner critic, is so powerful. It impacts us even physically. The next part of the exercise is felt uncomfortable. Yeah. So let's go to part 2 of the exercise. Now, before I go to part 2, that paper that you wrote those horrible things about yourself on, I want you to take it and tear it up and throw it away. That's right. That does not serve us. That is not going to get you to a place where you're going to feel confident and resilient enough to go forward and live your dreams. Now, new piece of paper, 20 seconds. I want you to write down the most loving, kind, compassionate, nurturing things you've ever heard someone say about you. Someone's being funny. Oh, that's funny. And the most kind, loving things that you've said about yourself. Think of the kindest things that you've ever heard and said to yourself. Here we go, 20 seconds. Okay. Our 20 seconds are up. Okay. Was that different? Did you experience a different feeling from when you were writing down the negative thoughts? Yeah, definitely. Isn't that powerful? Yes, it is. I love this exercise because what happens oftentimes is we're just not aware of how much negative self-talk we're saying to ourselves. Words are powerful. Remember this, words create our world. So now with the paper that you wrote all the positive statements down, I want you to hold on to that. And when you hear the critic, when the critic surfaces and says, you can't, you're not good enough, you're not worthy, oh my God, are you insane? You can't do that. I want you to pull it out and cancel the critic by reading and reminding yourself of your greatness, your infinite possibilities. So next slide, please, Sam. This is a quote by Tupac, and I'm going to go out on a limb and say everybody knows who Tupac is. It's a wonderful poem that I truly love. It's basically about a rose. Did you hear about the rose that grew from a crack in the concrete? Proving nature's law is wrong. Learn to walk without having feet. Funny it seems, but by keeping its dreams, it learned to breathe fresh air. Long live the rose that grew from concrete when no one else even cared. I love this poem. Tupac speaks of resiliency. Concrete is the challenges that we inevitably will face in our life. A life coach can support you, guide you through those difficult times and help you maintain, become resilient. I want to end with, next slide, please, Sam, a quote by Billie Eilish. Because I'm in love with my future. That is what life coaching is about. Helping a person fall in love with their future. That's it, guys. Do you have any questions? Put in the chat.
Yes. Thank you, Angela. I'm going to go ahead and ask the first question to you since you're on still. Do you think that your MSW, Masters in Social Work, was helpful to you in your approach to life coaching? Because as you mentioned, that's not a necessity to become a life coach.
Definitely. And so my undergrad is in psychology, actually, and my MSW, all of those experiences helped me because in psychology and also in social work, you're studying human behavior. And as a life coach, you don't need those degrees at all to be a life coach. However, I do feel like it gave me a head start, more like an advanced coaching style, because I'm bringing that piece of my education into my coaching. So, yeah.
So next question then, and this is to both you and Amy, what is the difference between a therapist and a life coach?
I'll tell you, a life coach, we focus on possibilities. We focus on potential. Sometimes when I meet with a client, after I do an assessment, I can tell that they need Amy. They need Amy. And Amy's gonna tell you why. Just think, like, when you come to me, I'll give this example. When you come to me, you don't really need to lose weight. You just wanna tone up and flex muscle. So you're like, you're needing some conditioning. Let's just say it like that. You're needing some conditioning. So you're not starting from a place of, I want to say this correctly. You're just needing additional help. You're needing additional support. Yeah. Amy, you want to speak to that?
Yeah, I would say that, can you hear me? I am muted. Yeah, okay. I would say that I love the analogy of the of the needing tone versus needing to lose weight. I would say that it is about, sometimes people have some severe issues, or need more specific help with how to combat depression, or someone who is really anxious and having panic attacks. And you're probably not going to go to a coach for that, because a coach isn't going to have the deep experience or education about how to treat those disorders. So I think, I think that also sometimes in therapists or psychologists, we do more of a in-depth kind of history review and kind of conceptualize, patients and people with more of a history, whether it's a childhood history, and we just, I think that we need to sometimes, for some reasons why people are coming into therapy, they need more of that depth and more of that understanding. It's more complicated. Although I do say, I think we you can't look back, you can't drive your car if you're only looking in the rearview mirror, right? You need to look forward. So I think there's also an element of psychologists that we're also looking forward and trying to help people achieve their goals and dreams. That is part of the most gratifying piece of the work, right? Is seeing people make change, right? Making whatever kind of changes, behavioral thinking changes, cognitive, all of that. So
Kay, you already answered this in the chat, but for those students that maybe don't have access to the chat, can you just summarize the difference between a psychiatrist and a psychologist to further this comparison? You're on mute.
I just realized. Yeah, so in psychiatry, so first, in order to become a psychiatrist, you have to go through medical school, which is an MD degree or a DO degree, and then you choose what specialty you want to go into. So in medical school, you learn about the human body, you have anatomy lab, you learn about physiology and kind of the pathology of the body. So it's kind of like, how does the human body work normally? And then what happens when things go wrong? And in psychiatry, we focus on the brain but there's two specialties actually focused on that, neurology and psychiatry. So psychiatry is a lot more on the behavioral side. And physicians, the MDs and the DOs, have the special privilege of being able to prescribe medicine. So whether it's antidepressants or antipsychotics. So we really build on the education that we've received on the human body and how it works, to how to safely prescribe different kinds of medicine at the right doses, making sure there's no contraindications between multiple drugs that a patient might be getting prescribed. So that's kind of the key difference, is that I think psychiatrists tend to focus a lot on the medication management aspects, and psychologists focus a lot on the psychotherapy. But at the end of the day, I mean, medicine is a team sport, and that's where, like, a big part of being a psychiatrist is also knowing when you need to then refer your patient to a psychologist or a neurologist or a primary care physician, right? So a big part of the education, the training, is also knowing what your team does, what your team's capabilities are, and fluidly working so that for the patient, they feel like they're getting, all the care that they need from their social workers, life coaching, psychotherapy, maybe like, kidney therapy, whatever it is. That's really a big part of, I think, being a doctor, is just also knowing how to connect your patient with all the right resources that they need to be able to get healthy or get treated.
But great, thank you. So going along with the theme of this question, Amy, in your opinion, what are the benefits of being a psychologist rather than a psychiatrist?
The benefits, it's less education, so you don't have to go to school quite as long. I would say it's already long enough. I also think, and I think this is changing somewhat, but what has happened because of more and more pressure on doctors, physicians seeing more and more patients, you don't get to spend very much time with your patient. And, as psychologists, we get to spend more time with our patients, right? And we get to know them more, and it's not always true. Some psychiatrists do spend more time, with their patients, but it's more, unfortunately, it's become more of kind of medication management on the psychiatrist part, when the psychologists here in California, we can't prescribe medication. So we just spend more time, getting to know the individual person and get to spend more time with them. And also, I think there's more flexibility in terms of our treatment approaches and what we're trained to learn of all the different types of interventions. Whereas a psychiatrist, you're going to medical school, of course, a lot of that's going to be on medicine, right? But I agree with Dr. Bren. I think it is a team sport, and I do a lot of coordination with psychiatrists because some of my patients also see a psychiatrist. And so we do, we talk every couple months to just coordinate to make sure we're doing the best work on both our ends for the patients.
Thank you, Amy. So we only have time for one more question. Really, we don't have time for it, but I'm going to ask it anyway. So Angela, somebody asked, how was your experience going through the coaching program? And also, how long did it take? You're on mute. Mute.
It depends on the program. The first program was 9 months, and the second program was a year. It was a fantastic experience. It was eye-opening. I learned so much about the importance of being quiet and truly listening to someone and not trying to fix them or tell them what to do. One of the great takeaways from the second program, I love their philosophy, and it is that everyone has their own answers. So if you walk into a session keeping that in your head, I'm not telling this person what to do, I'm helping them uncover what they already know about how to become successful and live their lives. Yeah.
Great, thank you. Students, please help me thank Kay, Amy, and Angela for their fantastic presentation.